My name is Kat, your veterinary rehabilitation technician, and today we are going to be talking about passive range of motion. Hi. Now, just a friendly reminder, always confirm with your veterinarian or a canine rehabilitation professional if passive range of motion is an appropriate activity for you to do for your dog's condition. They may provide specific instructions or restrictions just based on your dog's health, previous surgery, or injury. Now, passive range of motion is a therapeutic technique used to gently move a dog's limb through its natural range of motion without the dog actively having to participate. So this technique can help maintain joint flexibility. It can also reduce stiffness and improve blood circulation. There have even been studies to validate that it can help with pain management. So this is especially important after an injury, after a surgery, or even as part of their general rehabilitation or conditioning. Consider preparing your environment. You want to do this exercise in a calm, quiet space where your dog can feel relaxed. Have some treats handy or a reward to encourage your dog to sit still, and ensure that you are in a comfortable and safe position to support your dog. You want your dog to be in a comfortable and stable position. This can mean lying down, or this could mean standing. If they are laying down, consider having them on their sides. You have full access to the limb that we are discussing. And if you do need your dog to stand, but they don't have the strength to support themselves, consider using a soft cushion or blanket for added comfort, or even in some cases, you can utilize a peanut to help them stay balanced while you're doing this activity. Now, I like to look at each joint separately. This is going to provide additional neurologic stimulation for them and get those little neuroreceptors in each of those joints affected. So the first joint we're going to address is going to be the hip up at the top of the leg. We're going to do full flexion and full extension. So for the full flexion, that's going to mean bending the hip. We're going to gently move that rear limb forward towards their belly, ensuring that the leg is moving in a straight line without twisting. The hip joint will be bent and the dog's paw should be closer to the abdomen. Hold this position for a few seconds and then gently return to the starting position. Then we're going to go through extension. That's going to require you to move the limb backwards and extend that hip joint. Again, hold that position for a few seconds and then return to the starting position. Now, you want to repeat that activity about 5 to 10 times of just the hip, just moving the hip through those motions. Then we'll move down to the knee joint, also referred to as the stifle joint. For flexion of this, you want to gently move the lower leg upward, bringing that paw again closer to the body and not applying any excessive pressure. Hold again for 3 to 5 seconds before straightening that leg. For extension, same thing. Stretch out that lower leg, hold for a few seconds, and then return to the starting position. Repeat 5 to 10 times or as directed by your veterinary rehabilitation technician. Moving on down to the ankle joint, otherwise called the hock. We're going to do 2 different types of flexion just because of the way that this joint operates. So we're going to do dorsiflexion, which is flexing the dog's foot up. This is a small motion. We're going to be gentle and hold that foot and move the paw upwards towards the leg. Then we're going to do downward flexion or plantar flexion. That's going to be straightening that joint out, moving the paw downward away from the leg. Ideally, all of these exercises you want to do on both sides. This helps keep both limbs flexible and well balanced. Additional tips. 1, take it slow. Don't rush the process. Moving the joint slowly and gently can avoid causing any additional discomfort or injury to your pet. 2, observe them. Watch for signs of discomfort or pain. Are they trying to leave? Do they seem in distress? Are they pulling away? If so, stop immediately and consult your veterinarian. 3, range of motion is something that should only have the pet moving through natural and comfortable motion. If this is something that has to be forced, you could be causing some discomfort. Now, last but not least, frequency. How often should we be doing passive range of motion? Typically, it's 1 to 2 times per day for 5 to 10 minutes, depending on your pet's needs. But depending on your pet's needs, you may have different recommendations from your veterinarian. After the exercise, consider doing another little massage just to help smooth things out. It's nice and soothing for the pet, and that gentle massage can help relax those muscles to prevent a delayed onset of muscle tension. Keep an eye on your pet. It's normal for them to be a bit tired, but there should be no visible swelling or discomfort. Now, if your dog is in acute pain or has just suffered an injury or has just had surgery,